Welcome to the New Mom Talk podcast, your go-to podcast for evidence-based answers to your burning questions about parenting. Join us as we dive into commonly Googled topics and hear from experts and real moms. Let's navigate parenthood together, one question at a time. Hi, everyone. Today we're going to talk about a super important topic that I think is always on everyone's mind. It's about starting solids, but feeling confident with introducing allergens to babies. So this is a huge topic, right? We talk about peanut butter. I think that's like the biggest one that's you see at all ages. So that said, we have Carina Venter, who is going to share all of her knowledge with us.
My name is Carina Venter. I'm an allergy specialist dietitian. I'm also professor of pediatrics in allergy and immunology. I spend half of my time doing research about maternal diet in pregnancy and how that's associated with child allergy development. I spend a lot of time on the infant diet and how to prevent allergies in the child. And then the other 50% of my time, I work clinically with families with children with food allergies.
Well, you are definitely the right person for us to ask all these questions to then. So I wanted to start off with the first question with what are the most common allergens parents should know about when starting solids? As I mentioned, I know that peanut butter is like a huge one in that, or peanuts is always the one that everyone focuses on, but there's more than that.
That's true. So first I have to say that, food allergies can be divided into two groups. The first group is the immediate type. So when we eat that, like a peanut, for example, we expect to see some swelling of the lips or hives or even a few rashes within 2 hours. Normally it really occurs within 5 to 20 minutes, but 2 hours is our cutoff. And then we also have the delayed type of allergies, which can take a day or sometimes even a week to develop. So for the immediate type food allergies, there's a top 9 allergens, and these top 9 is also covered by the food allergen labeling laws. These 9 allergens include peanut, as you've said rightly so, milk, egg, wheat, fish, shellfish, tree nuts, sesame, and soy. For the delayed type of food allergies, we also see, reactions to the top 9. But very interestingly, we could see reactions to things that's commonly not considered to be allergenic, like oatmeal, for example, or rice, or even some fruit and vegetables.
Yeah, the ones that you really don't think about, right? So with all of that said, starting solids just is always kind of a time that brings parents a lot of anxiety. So how can parents feel more confident and prepared before introducing these allergens to their babies for the first time?
I think the main thing to remember, and that is my first discussion that I have with families in clinic, is that the younger the immune system and the younger the baby, the more compliant or pliable the immune system is, and the happier it is to actually accept food allergens. We very rarely see anaphylaxis in babies. If baby's going to have a reaction, it's milder. Even though it's really scary to think, I have to give my 4-month-old peanut butter, it's actually the safest time to give it, or my 6-month-old, whenever the baby's ready to eat, rather than actually waiting until the child is older and the immune system may be less pliable. And that really applies to prevention, but also treatment. We never used to do oral immunotherapy in young children, but we now actually know that if we can get them before 1, it's much more successful, and if they're going to have reactions, it's going to be much milder. So that's the one thing. It's really safe, and really the earlier the better, but obviously we're not going to start feeding babies allergens before 4 months. We're going to wait until they're ready to eat, then we're going to give the allergens. And the second thing is just to make sure that the texture is also safe and not a choking risk. And so the American Academy of Pediatrics is very clear about the fact that nut butters never should be fed off a spoon as a butter. It always should be diluted either with hot water, cool down, infant formula, or nothing better than breast milk to mix allergen butters with when we feed it to babies.
So I'm actually glad that you mentioned that, like thinning it out, because that leads me to my next question as far as specific foods or forms. Like, what's the safest way to introduce other allergens? You mentioned peanut butter as one with being, thinned out, such as mixing it with breast milk or water, but anything else?
Yeah, so milk is always the easy one because either infants already had some infant formula or yogurt, is a wonderful way to introduce milk protein to an infant. It's also got the probiotics, which is good for the infant's gut microbiome. The second one is the tricky one, and that is egg. And with egg, I hope you're going to allow me just a minute or so to explain. The best way to introduce egg probably is a boiled egg. But when we boil egg for up to 10 minutes, we destroy one of the allergens in egg. And so as much as it's a good and safe way to initially introduce egg, mashed up egg, which you can then mash with banana or perhaps even some carrot puree, it's important to move on to more allergenic forms of egg, such as a scrambled egg, cooked for about 6 to 7 minutes. And once the child's had that, then we can actually go on to scrambled egg, which is moist, like the scrambled egg we would eat. The reason I don't jump to scrambled egg, moist scrambled egg immediately is just because we know that babies react to the scrambled egg. They're not necessarily gonna, have anaphylaxis, but I think a safer and more gradual approach is boil, scramble well, and then just scramble egg as the family eat. And then the peanut butter and all the other nut butters, as well as seed butters such as tahini paste or sesame seed butter, I can put in one group. Butters can be fed, as I said, mixed with formula milk, breast milk, water. I love mixing butters with yogurt because, once again, you give the butter with a very good probiotic, which is good for the immune system, and it helps the immune system to tolerate allergens better. But it can also be mixed with fruit and vegetable purees, or, families where culturally they eat a lot of curries. No reason why, the peanut butter or the cashew butter cannot be mixed in with a family meal for the baby to eat.
These ideas that you're sharing, I'm a huge fan of peanut butter, so it was really important for my son to love peanut butter, and he does. But with introducing allergens, obviously parents don't want to do all of them at once. So what is the best way to kind of space them out so that parents, one, can feel more comfortable, and two, like, why would that even matter, spacing them out? Hi everyone, it's your host Mariella. I wanted to thank you for listening and share some ways to show your continued support. You can rate and review on Apple Podcasts or Spotify. Share the show with friends and family. Buy me a coffee to help with the financial costs of running a podcast. Follow me on Instagram at newmomtalk.podcast. And finally, subscribe to my newsletter. Thank you for listening.
The first thing to remember here is, which people often tell me when I talk about introduction of allergens, they say, but did you know the AAP or the American of Pediatrics say that we should wait 3 to 4 days between each new food? But the Academy of Pediatrics actually did publish a book where they stated that previously we recommended introduction of foods every 3 to 4 days, but the latest research, and some of that's actually my research, indicates that it is fine to introduce multiple foods at once. So I want to say that's what they say. There's no guidance on how much food allergens have to be spread apart when we introduce it. My clinical practice and my personal opinion is to introduce cashew and peanut butter in one go, or mix egg with sesame butter as a first introduction is perhaps pushing it a bit too far. So clinically, we would suggest to families that they wait 2 days, or do the same allergen 2 days. Let's say we do peanut Monday, Tuesday, then perhaps we can do cashew Wednesday, Thursday. Having said that, food allergies, as I've explained, immediate type, they're going to occur within 20 minutes. So if you've done peanut butter on Monday and the baby was fine, there's no reason why you can't do cashew on Tuesday and egg on Wednesday. We do like this term shared decision making, so I really also talk to the parents, see where their comfort level lies. I have parents that say to me, absolutely no way. We're going to do peanut 1 week, next week we're going to do egg, and the week after we're going to do cashew. I'm fine with that. I have mothers who call me after a consultation the next day and said, I felt so brave and so reassured after speaking to you. Actually, I've done cashew for lunch yesterday and peanut butter for dinner, and baby's fine. So I think it really depends on families. But the only thing I would say is that perhaps two allergens for the first time in the same meal is not such a great idea, but you could definitely do it 2 meals apart, 2 days apart, or split it as far as you want. But we really, especially in children with eczema, we have a race against time because allergens are everywhere in the air, not sufficient to give us allergic reactions, but sufficient to penetrate the skins of babies, particularly babies with eczema or dry skin. The skin is not a friendly immune system. The skin wants to cause allergies. The gut is a friendly immune system. It does not want to cause allergies. So we really want to get the food in the baby's tummy before it's going to penetrate via the skin. So if I have parents that say to me, we're going to do peanut for a month, then cashew for a month, then egg for a month, I'm going to say, you know what, we need to really have a good discussion and reconsider the timeline because, it's just too delayed to actually wait that long between allergens.
Wow, I learned a lot because, yeah, you are told like, oh, every 3 days, which I've always kind of thought is like, well, you can't introduce enough foods, right? Or if you're waiting every 3 days, okay, day one, they get avocado, day two, they get broccoli, day whatever. You know what I mean? So you're really introducing two foods a day, and that's just not enough for variety. That's my personal opinion.
That's true. And if I can add to that, so my research, and it's been now, replicated all over the world, even in Asia, shows that with every additional food you give a baby, you bring their risk of food allergies down by about 10%, and each additional allergen brings the risk down by about 33%. So every food counts. We should just let babies eat and let them love food rather than being so restrictive and scared.
I love that. Let them love food. I love food. My son loves food. So, yes, let
That's
them
good.
love food. So, I want to talk a little bit about the reactions. You touched on it a bit, but how would a parent or parents handle if they find out their child is having a reaction to an allergen? And what is the difference between a minor reaction versus one that would require them to go seek some medical attention or medical help?
Good. That's a very good question. And I have been involved in the development of an early introduction range called Grow Happy. And if you go on their website or sign up, we have an early introduction weaning guide. And we discussed this whole concept of what is an allergic reaction, what is less severe, and what is more severe reactions within this weaning guide. And it has really been edited and approved by the top 5 allergists in the world. So if you want a really good guide on allergic reactions and how to deal with it as a parent, that weaning guide is your answer. But I will also give you my opinion. So babies tend to get rashes. They often get rashes around the face, but if you wash them, it will disappear, within 5 to 10 minutes. They may also get a few hives. Somehow we decided in the allergy world that 1 to 2 hives is minor and nothing to worry about. But if there's more than 2 hives, that's perhaps the time when you want to give some antihistamine or even call your PCP and discuss it. So it's really what we're looking for is swelling of the lips, more than 2 hives, more extensive rashes than just rashes on the face. We don't like it when babies start wheezing, so that's another time that perhaps we will get concerned and call for medical help. And obviously when babies get floppy and sleepy, that's a really bad sign, and we definitely want to call for medical help at that point. Having said that, I started by saying, the first year of life is a really, really safe time to introduce allergens. And having these severe reactions while introducing allergens is almost unheard of. You can never say never in allergy, but highly unlikely to happen. At best, I work with parents introducing allergens literally on a daily basis. And at best, I get, they had a few rashes, little bit of a swelling in the corner of their mouth, 1 or 2 hives. And I really want parents to be reassured that it's a very safe thing to do.
Wow. It's very interesting that it's 1 or 2 hives. Like, yes, that is such a random thing to, I guess, look for, because now you really are going to be counting. Wait,
Yeah.
does this count as a third? Is it not? So thank you for all of that. And well, finally, my last question. Do you have any other tips, suggestions, or recommendations for anyone that is about to start this journey and the best way to really just go about it to feel confident?
Yeah, so I think, the three buzzword is start early, do it often, and keep going. Because to just give one little bit of peanut butter and think no reaction, so I've done it, baby, it's good, is not going to help. In the LEAP study where they looked at the prevention of peanut allergy, the children were actually eating peanuts for 5 years, and they showed an 80% reduction in peanut allergies. Introduce the allergens, be brave, don't delay allergen introduction. I am involved in this product called Grow Happy. Please, go on the website. We have this wonderful weaning guide, which introduction of solid food and introduction of allergen guide that I think is very helpful for parents. We also in this range have 5 what we call immunobutters, and because really feeding babies is a wider concept than just feeding food allergens. And so what we have is the 5 allergens: peanut, cashew, walnut, sesame, and egg. Each of the butters are mixed with 2 or 3 fruit and vegetables, because we do think that food allergens need to be fed within the context of a diverse diet. And so the 5 butters also give 16 plant-based food. Every ingredient was very intentionally chosen. We've studied how the blueberries we used mixed with the peanut butter change the gut microbiome and drive down the allergy immune cells. We have good data on our butters and how they specifically benefit the gut microbiome development. So I think, to cut a long story short, don't be scared, start early, keep going. And if you need some help, there is a range out there that can hopefully set you on this path of introduction and continued intake.
Thank you for all of that. So I'm going to have all of your information linked in the show notes. So if anyone wants to connect with you, they can also access your website from there and learn more about what you do and everything that you just shared with us. Because I know it's hard to just think one episode is going to be enough for me to feel confident, but to be able to go through and look at everything and really get your professional input on how to do it confidently is going to be essential. So thank you.
Thank you.
Thank you for listening. Tune in next week for our next episode. You can find us on Instagram for more updates and tips. Be sure to subscribe wherever you listen to your podcasts and give us a review if you like us.